Welcome to today's program sponsored by the Bahá'í Chair for World Peace at the University of Maryland. We are located in the College of Behavioral and Social Sciences, and my name is Hoda Mahmoudi. I'm the director of the Bahá'í Chair for World Peace. Today's program is being co-sponsored with the Critical Race Initiative program in the Department of Sociology and with the School of Public Health at the University of Maryland. I would like to thank Dr. Kate Seaman, the Assistant Director at the Bahá'í Chair for World Peace, for all of her assistance in making today's event possible. Now, I'd like to go over some technical issues as we normally have to within this virtual environment. You are muted and your video is turned off as you join this program. And please note that the program is being recorded and it will be posted on the Bahá'í Chair's YouTube channel. By participating in this program, you acknowledge and consent to your image, likeness, or voice possibly being recorded. And you will have, of course, after the lecture, the opportunity to submit your questions in the Q&A function on the bottom of the screen, but that will happen once the lecture has ended. At the Bahá'í Chair for World Peace, we are working step by step to understand human nature, to address the root causes of sexism, racial prejudice, conflict, inequality, and social, economic, political, and religious mistreatment of all kinds. Our aim is to provide a platform and an archive of human understanding, and to shine light on those issues and those individuals engaged in a good work. And this brings me to today's important lecture. Of course, I will introduce our distinguished speaker in a minute, but first, a little bit about COVID-19. COVID-19 is both indiscriminate and lethally targeted, coming into our society through the door of systemic racism and economic and racial caste. And while it cares not if its targets are Black or white, Asian or brown, its impact within already existing structural realities has ensured that those whose economic houses were already built on sand, as it were, have had what little they do have washed away in the storm of COVID. These circumstances bring to new light life's disparities, challenging us yet again to think about how government institutions, global society, civil, academic, religious, and cultural institutions address frightening differences in the life possibilities that challenge us all. In this era of social distance, we must think anew of the legacies of slavery, of immigration, and of structural inequality that have always distanced some of us from each other and distanced us from prospects of prosperity and happiness for all. Our distinguished speaker today, Professor Stephen Thomas, will examine how COVID-19 exposes what is wrong and right in how different societies are organized and structured. It's really an honor to have him with us today, and I would like to tell you about his great work. Professor Thomas is one of the nation's leading scholars in the effort to eliminate racial and ethnic health disparities. He has applied his expertise to address a variety of conditions from which minorities generally face far poorer outcomes, including cardiovascular disease, diabetes, obesity, and HIV/AIDS. He is the principal investigator with Dr. Sandra Quinn, also at the University of Maryland, on the Center of Excellence in Race Ethnicity, and Health Disparities Research, funded by the National Institute for Minority Health and Health Disparities. Dr. Thomas has received numerous awards for his professional accomplishments, and over the years, his work has become recognized as one of the scholarly contributions leading to the 1997 presidential apology to the survivors of the syphilis study done at Tuskegee. His current research focuses on translation of evidence-based science on chronic disease into community-based interventions designed to eliminate racial and ethnic disparities in health and healthcare. More specifically, he has focused on understanding how social context shapes attitudes and behaviors of undeserved, poorly served, and never served segments of our society toward participation in health promotion and disease prevention activities. Dr. Thomas is particularly interested in how the legacy of the syphilis study at Tuskegee, which was from 1932 to 1972, has impacted trust and influenced the willingness of African Americans to participate in medical and public health research. The title of his lecture today is The Colors of COVID-19, Confronting Health Disparities During a Global Pandemic. It is with a great pleasure and honor that I welcome Professor Thomas.
Hello, Professor Hoda. May I call you that?
Of course.
For our talk today. Stay on screen with me just for a moment. We'll stay in our little Hollywood square so they can see us. How are you? It's been a long time. I miss you.
Yes, me too.
And I've been to your lectures when we were on campus, and I said, one day I want to be in this audience. And so here we are by way of Zoom.
Wonderful. Excellent.
So you see, I changed my my virtual background.
I see that. You surprised me.
So tell me, where is this?
This is the international headquarters of the Bahá'ís of the world. It is in Haifa, Israel. And the building that you're looking at is one of the shrines of one of the founders of the Bahá'í faith. And those are the gardens in Haifa.
And so my wife and I were in Israel with our son, and we went to the international headquarters. Beautiful gardens, as you can see where we're standing. And one of the very interesting things was that, and you have to correct me if I'm wrong, that they are there in Israel, in Haifa, the international headquarters, but they do not proselytize in Israel. They do not recruit for members in Israel. Is that correct?
That is correct.
So again, in the context of just a faith tradition, how depending on where you are in the world, there are cultural norms and restrictions and limitations, but that does not limit our imagination. Am I correct?
Yes. Wonderful, yes.
So an honor to be here. And when we were standing at this overlook, we were there with people from, guess what? All over the world learning about the Baha'i faith. Mm. So thank you very much for introducing me to the audience and introducing me to the Baha'i faith and tradition. And when I came to the University of Maryland 10 years ago, can you believe that? I arrived in 2010. I had no idea there was a Baha'i chair right here in College Park.
Yes.
So what an amazing time we're in. 100 years from this day, my friend, they'll talk about this moment we're in. So you, me, the audience, we should all look in the mirror and ask ourselves, what were we doing when the world was facing a pandemic? I'm going to take a moment and share with the audience some slides. But what I need you to do is to cross your fingers. We're all in this digital world and Zoom world, and we all need tolerance, right? For all the things that can go wrong. So I'm going to take a chance here and share my screen. And I want you simply to tell me if you see a full screen.
Yes.
Okay, here we go. So yes, I have titled this talk, The Colors of COVID-19, because one of the things that the pandemic has done, in my opinion, is expose what W.E.B. Du Bois said many, many decades ago. He said that the problem of the 20th century is the problem of the color line. That problem extends to this very day in the 21st century. We're still grappling with it. And with all the progress that we have made, the pandemic, and even before the pandemic, makes clear we have a long way to go. Would you agree, Dr. Hoda?
I sure would agree. Yes.
From George Floyd to Freddie Gray, I mean, we can go down the whole list in the criminal justice space that we've seen. And then the power of these things, the power of the telephone to give real-time evidence of the persistence of racism and discrimination. In many ways, this phone is like our truth and reconciliation model here. Because what people saw that happened to George Floyd, it could not deny their own eyes. And now the pandemic has put us into the public health space. And I would submit to you, with all the problems we have in the country, that it is in the health space that we have solutions. And it's because the people in the health space, the professionals in that space, have dedicated themselves, they've taken an oath to save lives. And I think we can come back together as one people across all that we think may divide us by focusing on improving health outcomes, especially for our most vulnerable neighbors. So I bring you greetings from the University of Maryland School of Public Health, established in 2007, first accredited in 2010, and then reaccredited in 2015. It's been a real honor to be part of a new school. And again, the pandemic has thrust public health into the public eye. Dr. Hodem, my students are saying, their parents are saying to them, "Oh, that's what you do." I thought you were going to be a physician or a nurse, or no, I'm in public health, mom and dad. Now those parents understand this is what you do. Population health, health promotion, disease prevention. Public health is it's hidden when it's working well. It's when it doesn't work that you begin asking the questions, why is my water polluted? Why is my air polluted? Why am I living in a food desert? Why is this pandemic, as you say, it doesn't discriminate, right? It's like a storm that we're all in, but we're in different boats, Professor Hoda. And some people are not in boats at all. They're in inner tubes and homemade rafts. And now we see what a broken infrastructure can do, because we have racial and ethnic minorities who were already suffering from the pre-existing conditions, as they were called. Those were all the chronic diseases. And now COVID has exposed how those chronic diseases exacerbate the worst outcomes of COVID. What I say here today, I'm not expecting everyone to agree with. In fact, Professor Hoda, you and I may disagree, but I'm hoping that we can model in this moment how not to be disagreeable with one another, how we can find common ground, and sometimes agree to disagree, but still respect one another's worldview. So, Dr. Hoda, here's the other interesting thing about being in the professorate. When every freshman class comes in right around the same age, don't they? And we're the ones that are older, right? And so what I've learned is that some students don't know who this is. Do you know who this is? This is a drawing that was done for the 50th anniversary of the March on Washington. And it was done by an undergrad student at the University of Maryland. I was so impressed at what she did with Dr. Martin Luther King's image. I've always kept it in my presentations to remind ourselves how far we have come in this country with that dream. And here we are in a pandemic. If you look back in history, ancient history, plagues and pandemics change societies. So we must not lose our dream in a democracy that brings us all together, that treats people by their, not by the color of their skin, right? That everyone has an opportunity for a full and healthy life. At the University of Maryland School of Public Health, we are committed to getting off the campus, Professor Hoda. How can it be that we sit here in Prince George's County and in the shadow of our buildings, people are suffering from the very things we say we're expert in? And you could do that around any of our academic health science schools in the country. You could do that 1 mile radius around Harvard. You could do that 1 mile radius around Hopkins, the University of Pittsburgh, you name them. And you'll find in many cases some of the worst health outcomes in the shadow of institutions that are famous for advancing science. How can that be? You could be in such close proximity to all the science and technology that exists at our academic institutions and yet still suffer. So we have been building bridges off the campus into the neighborhoods. And our theme of building bridges, building trust, building healthy communities could not be more evident right now, where we have people who are at risk for an infectious disease, COVID-19, and yet the message about how to protect yourself is muddled with confusion. Professor Hoda, why would we be fighting over wearing a mask when we know it can protect lives? Why would we be fighting over the very public health mitigation strategies that we know work? And yet we are finding ourselves the most advanced medical infrastructure in the world. Look at us, Dr. Hoda. This virus has humbled us. It has brought us to our knees, literally. And when you look at our peer countries around the world, they are not having the same bad outcomes that we are. And we're not used to being the example of what not to do. Now, at the end of the day, I think we, as Americans, all rally together and we'll get this right. But let's acknowledge how this virus, invisible to the human eye, has humbled a great nation. And that's where the issue of race and racism once again raises its ugly head. So we need to say her name, Dr. Susan Moore. You may have seen this story. A Black physician who became infected with COVID, ended up being hospitalized. This is in Indiana. And Professor Hoda, she had to pull out her Truth and Reconciliation cell phone and use FaceTime to communicate to a world beyond the walls of that hospital that she was experiencing discrimination. And she's a physician. So she got an education. She got a college degree. She went to medical school. She is a practicing physician. but she doesn't have the white coat on. She doesn't have a stethoscope around her neck. She has a hospital gown on. And all of a sudden, she's a Black woman in America. And she's describing what it was like being that Black woman in America in a hospital that treated her with disrespect. That's why it was a front page story in the Washington Post, in the newspapers all over the country. So I want your audience to take a moment, look in your chat. Dr. Kate is going to put a link there. And you're going to go to a Poll Anywhere site. And I want you to wait for me to give you some instructions. So Professor Hoda, you're going to be my cue.
Sure.
So do you see that link in the chat box?
I do.
So go ahead and click on it. And those in the audience, you should be able to click on that or copy and paste it into a browser.
Yes.
I'm going to stop sharing and I'm going to see you on the other side. Now stay right there.
Yeah.
And Professor Hoda,
yes,
cross your fingers.
Yes,
I'm doing another technical thing.
Okay. Yes.
Okay, now I'm going to come back in and share my screen. And for the audience, just keep putting one word in at a time. As many words as you want, just one word at a time. I'm going to share my screen now. And Professor Hoda,
Yes.
do you see the word cloud being built?
Yes, I do.
Okay, so your audience out there, I think we have, look down, I think we have about 119 people in.
I have 124.
Okay, 124 people. We have 60 seconds audience out there. Keep putting those words in as fast as you can, just one word at a time. And Professor Hoda, look what's happening right before our very eyes.
Yes. It's very interesting.
So I want you to talk to me about what you see. Talk to me about what you see.
It's interesting. I see tired and hopeful right now, as you know, and then isolated, anxious, lonely, exhausted, desperate, distressed, blessed, grateful, paranoid, cheated, bored, unmotivated, angry, amazing, amazing.
So we'll let them keep building, audience out there, keep building. So the larger the word, the more people that put that word in there.
So
okay?
Interesting that hopeful is winning, but so it's tired.
So think about this, that hope is fragile.
Yes.
That hope may be one news cycle away from despair.
Mm-hmm.
That hope is constrained by the little words that you see, the challenge, the exhausted.
Yes. Yes.
So it's a mix.
It is a mix. And now I see lonely and overwhelmed, drained, grief. So it's a mixture, it's a.
And just keep building, audience, keep building. And so one of the things we must do is not lose hope. Okay? And so as people become more aware of how to protect themselves, no one imagined we'd be in this for an entire year. Dr. Hoda, when we started, I did not have hair on my face. But I said to my wife, I would not go to the barbershop until Black people have access to the vaccine.
Yes.
So I haven't shaved yet.
Yes.
So
yeah.
COVID has aged me. You see, I never even knew I had these white hairs. So we're going to make sure that you have the final version of the word cloud, because it's something I think we should watch over time. It's also something that will change over time. And so I will, every time I do something, I always want you to cross your fingers for me. I'm going to take a little photo of what I see here. And I'm so glad that we have the audience still entering words. They're still entering words, Professor Hoda.
It's so wonderful. Yes.
Hopeful still big, but look how big exhausted's getting and tired and
Exactly.
isolated.
Isolated, right. Yeah.
So here again is where COVID may have opened up a door for us to find new ways of connecting even while we're being socially distant.
Mhm. Yeah.
Okay, audience, I'm going to now take you to the next question, and you can stay right there. Did your options change for you to vote, Dr. Hoda?
Yes, they did. Yes.
Okay, so go ahead. In this case, you're going to vote based on what you know today. How likely are you to take the COVID vaccine when it is available for you? Go ahead and place your vote, and we should see that start to build.
Mm-hmm.
Let me go ahead and present.
Yeah.
There we go.
Wow.
Now you see what I see, Dr. Hoda?
I'm amazed. Yes.
Now, what we don't know are the demographics of the audience out there.
Sure.
I can tell you that in the neighborhoods I work in the Latinx neighborhoods and the Black neighborhoods, we have a little different profile.
Yes.
But this is quite interesting. So imagine this with the hope surrounded by all that anxiety,
Mm.
people in this audience are ready to take that vaccine. Now, that's not everybody, Dr. Hoda. Are you watching?
Yeah, I am.
We
Yeah.
got 11% are saying somewhat likely,
Mm-hmm.
and we have a percent so small it doesn't have a number yet,
Right.
not likely at all.
Mm-hmm.
So even among us, we have people on different parts of the continuum.
Mm-hmm. Yes, it's very interesting, actually, the figures that have shown up here.
So I'm going to take my little screenshot of this one.
Mm-hmm. Now you have a not at all likely number at 4%.
4%. Now, if you take that up to a population level, that's not a trivial number.
No.
Or if you look in certain groups, that also may well vary.
Yes.
Okay. Let's see here. Okay, our last poll, here it is. What are some of the reasons you hear? Now, this is what you hear. It's a family member, it's a neighbor, it's a clergy. What are some of the reasons you hear for why people are reluctant to take the vaccine? And you can select all that apply. Dr. Hoda, do you see this thing growing?
I do. I do.
They're concerned about the speed of the vaccine process,
Yes.
concerns about the vaccine safety,
Mm.
lack of trust in the healthcare system,
Mm.
concerns about cost, and then issues that we may not even know about other because we don't know deep insight into certain communities.
Yes.
What about our Latinx community, our immigrant community, concerned about immigration issues, and whether showing up at Six Flags and requiring to show paperwork or signing up online and having to give a social security number would make people reluctant
Mm-hmm.
to take the vaccine.
Mm-hmm. Yes.
And concerns about safety is the largest one. Now, what's interesting, yes, is an FDA approved vaccine, right?
Yes.
And yet they're concerned about safety.
Mm-hmm.
And every day we take risks when we get in a car, when we get on an airplane, and we have to figure out how to balance those risks against the benefits. Because in this pandemic, guess what? We can leave no one behind.
Mm.
If this virus is living anywhere, that means it's evolving. And if it's evolving, guess what? It could come up with a way of bypassing the current vaccines that we have. Do you understand?
Mm-hmm.
So that means in the most remote little village in Africa somewhere, we cannot allow that community, that village, to simply harbor this vaccine, harbor the virus, because it will spread. So you're already hearing about the UK variant or the South African variant or the Brazilian variant. And guess what? Now there are variants coming out of the United States.
Mm-hmm.
As long as it evolves,
Mm-hmm.
it can mutate. into a form we can't control. So now it's about speed of getting people vaccinated fast to get ahead of the curve.
Mhm.
So I'm going to take a little photo of this.
Yep.
And just tell me before we leave this space, what you think about these results.
I find it very interesting that, the concern about vaccine safety, 59%, sometimes it goes up to 60, but lack of trust in the healthcare system. I mean, those two have a very important interaction with one another, right?
Indeed.
Yeah.
And,
I think trust has been one of the biggest issues with this whole pandemic.
and as people get frustrated, after they get over their hesitancy, being hesitant doesn't mean no forever.
Mm-hmm.
Being hesitant, particularly in certain populations, may be quite legitimate.
Mm-hmm.
But once they get past hesitant to where do I sign up? And from where do I sign up to why aren't they calling me back? Why can't I get an appointment? Now we're building up frustration.
Mm-hmm.
So we need to pay particular attention because some of these things could last even after we get on the other side of the pandemic.
Mm-hmm.
We could permanently hurt trust in our healthcare system. We could permanently have people have concerns not just about the COVID vaccine, but vaccines in general, flu vaccine, childhood vaccines. So there's a lot at stake here. Okay, I'm going to take a chance. I'm going to come out of this. If I had a drum roll, I'd applaud that audience out there. Didn't they do a good job, Dr. Hoda?
Fantastic job. Fantastic job. Really.
They did a wonderful job, and we want to thank them, and we want them to get ready for the questions and answer period. So we have come through our word cloud, we have come through our questions, and now that issue of trust in the healthcare system. And interestingly enough, after the death of George Floyd, many of our institutions came out publicly to say that they were committed to becoming anti-racist institutions. Do you remember that?
I do, yes.
From hospitals to universities to high school principals writing letters and op-eds. And so I'm going to take you inside the hospital. I want that audience out there to put their racist radar lens on, and I want you to tell me when you see the institutional racism in our healthcare system. Okay, now I'm going to try this again. I want you to cross your fingers for me. And here we go. And Dr. Hoda, let me know, do you see a full screen there?
Yes.
Do I have my thumbs up?
Yes.
Here we go.
I'll know forever where I was
on your end, audience, you can adjust your sound accordingly. Here we go.
I'll know forever where I was on this day because today I received my first coronavirus vaccine. So excited. I'm a teacher. I'm in the School of Public Health. We went to the website and teachers are listed as a priority. I'm here. And maybe it's just a coincidence that the hospital is located on Good Luck Road. But that's what I feel. I feel like I have good luck. I'm fired up and ready to go. Okay, thank you. The election, the inauguration, the insurrection. And then I get my email that I can get my coronavirus vaccine. I mean, all that in a matter of days. I feel like I'm living through history. Is my driver's license like this?
Let's do the thing. Let's do the thing.
We all have our motivations. That is true. And my motivation for getting the vaccine, because I want to be around for the people I love. I want to be around to see graduations. I want to be around to go to the weddings. And unfortunately, even some of the funerals that I've missed because of this.
Oh, wait, I'm going to give this back.
I want to be around for all the things that we look forward to in life, and this is one way to turn the corner. I have to admit, I was a bit of a baby. I looked away. I couldn't look at the needle. Tell me when it's over.
It's over.
It's over.
How was that?
You did it already.
I did it already. And I can hardly tell where we did it, but I do right there. Okay?
That's it.
And for being such a great patient, you get a sticker.
It was painless. I didn't even know it was done. Okay. They laughed. They had the same joy I did in receiving the vaccine. They had joy in giving it to me. I follow you?
Yes, sir.
Okay. So I think that sense of community is the silver lining around this pandemic. My options are
11, 12, 13, and 15.
of February.
Yep.
What's your motivation to get it? But what's your motivation to hesitate? And Tuskegee comes up as the reason why many black people are afraid. That is true, but that's just the surface. Let's go a little bit deeper. And the deeper lesson is that the protections, did you see all the paperwork I had to fill out? That was all to protect my privacy. Those are all part of the legacy of Tuskegee, to protect people. That's the conversation we need to have. And then we need to share why we did it. I think it's real important that we try to give a sense of hope for a better day. I think we can reduce the fears.
Okay, Dr. Hoda, are you still there with me? Come on back on camera.
Yes, I'm with you.
And I want you to tell me, did you see the racism in that hospital system? Did you see it?
Tell me about it.
Tell me what you saw.
I didn't. I actually saw a very helpful nurse give you that explanation.
A nurse who looked like me, right?
Yes.
And for the audience out there who knows, Black English, they could just hear her little idiom, her little local dialect, and it was warm. It was wonderful.
Mm-hmm.
And yet it doesn't mean that institutions are not still suffering from institutional racism. But there are ways that we can move forward together. And I think Doctors Hospital, right down the street here, our neighbor, is one of those places. And so I think it was important for people to see that we do have African-American healthcare professionals. We do have a way for people to feel comfortable about getting the vaccine. And we need to share our story when that time comes to help people get over their anxiety and hesitation. And so that's why what we're doing here today is so important, and for your audience to also share their stories. Now, one of the things that I want to say is that history matters. And even though you didn't see blatant racism in that scene, there is a history that has shaped the attitudes and belief of many African Americans and others towards the healthcare delivery system. In some ways, their distrust is legitimate. And some of that, if you've read the newspapers, comes from this legacy of the Tuskegee syphilis study. I think it gets a lot of visibility because it is think about it, a little small town in Macon County, Alabama. How could a little small town, a story coming out of that little small town, echo so far into the future? Started in 1932, not stopped until 1972, 40 years. It wasn't stopped by the healthcare professionals. It was stopped by a member of the press that wrote a story. So I hope we have some journalists in this audience. A free press is vital to keeping us free. But as you can see here in this photo, the physicians went to the people. Isn't that what we're asking our health professionals to do now? Get out of the hospitals, get out of the clinic, go to the people. Look what they did back in 1932. They literally went to the cotton fields where the people were. They drew their biosamples, the blood draws, right there in those fields. And notice in this photo, everybody's smiling. These were the doctors, these were the good guys who came down every year to do physicals on the men in the Tuskegee study. They were seen as the good guys. What are we doing right now in the name of we're here to help? That 20 years from now, 40 years from now, we'll look back and see that we cast a shadow because of the inequality and the inequities that were present in our moment right now as it relates to our response to this pandemic. So when the story broke, and this is the power of the editorial cartoon, right? That image tells it all. It was never a secret, Dr. Hoda. The articles were written in the medical journals, like 20-year retrospective of untreated syphilis in the Negro male. That was like normal. But everyday people didn't read the medical journals. And the men in the study were illiterate. They had no idea. But the scientists, in order to determine the effect of syphilis in Black men, needed to have an autopsy. Now, here's what's interesting, Professor Hoda. During this time, they literally believed that Black and white people were different species and that disease in Blacks and whites were different. And from a study in Norway, they found that syphilis affected the neurological system, and they believed that in Blacks, it affected the cardiovascular system. But Professor Hoda, here's how racist science even operated then. They thought it affected the neurological system in whites because whites had what? Bigger brains, smart, right? But for the Black men in the Deep South, it was their physicality like chattel. So it must be the heart. And they wanted to prove this by seeing what would happen if syphilis went untreated. It's a complicated story, but look at that sign. Secret Tuskegee study, not a secret, free autopsy, free burial, and a $100 bonus. They had to get the men to agree for an autopsy. Many of them didn't know what that was, and based on their religious beliefs, may have seen it as sacrilegious. So they said that they would give them burial insurance. Now today, Dr. Hood, if I join the study, I get a gift card at Amazon. But they gave these men burial insurance. And that was a big deal because poor farmers during that time period were typically buried in a seed sack. But these men, because they were part of the Tuskegee study, were buried in caskets. Isn't that amazing? Live all your life poor and die middle class. So they use anthropology and other kinds of methods to understand what are the levers in this population we could move. And when they learned about this fear of how their people are buried, they came up with this idea, not to empower the people, but to get them to do what the scientists wanted them to do, agree to an autopsy. On May 16, 1997, President Bill Clinton officially apologized. Now think about this, Dr. Hoda, 1932 to 1972. It wasn't until 1997 that there's an official apology. But with and this is Mr. Herman Shaw there. Now think about this poor farmer in Macon County, Alabama, he's now in his 90s at the time this picture was taken, is now at the White House with the President of the United States. Amazing arc. You have to agree, only 8 men were left alive at the time. But many of the family members of these men were still angry. The people who ran the study at Tuskegee diminished the stature of man by abandoning the most basic ethical precepts. They forgot their pledge to heal and repair. They had the power to heal the survivors and all the others, and they did not. Today, all we can do is apologize. Now, that's an apology from a president who wasn't even alive in 1932. What we need to do, Dr. Hoda, is move towards atonement, which means making things better. And I submit to you that the national campaign to eliminate racial and ethnic health disparities is part of that atonement. And I would submit to you that the current Biden-Harris administration's commitment to the equitable distribution of COVID-19 vaccines to vulnerable populations can also be part of that atonement if we get it right. If we get it right. The legacy of Tuskegee now lives in the form of movies. Miss Everett's Boys, it's a fictional account. It's an award-winning movie. It lives in jazz music by Don Byron, and it actually lives in comic books by Marvel, their first Black-focused comic book. Even I didn't know this. I'm looking at your face, Dr. Hood. You may not read comic books, but that's that's how deep in the culture this story has gone. And so imagine that we go down back to Tuskegee, Alabama, back to Macon County, where the very men in the Tuskegee study lived. And I'm going to introduce you to the former mayor of Tuskegee, Alabama. Now, every time I do this, you're crossing your fingers says, help me. So cross them again, because we're going to do some technical things here. And adjust your sound on your end, scholars. Adjust your sound on your end. And let's see if this works. And Dr. Hoda, do you see that as full screen, a man in a t-shirt?
Not yet.
Okay, hold on. I'll come out. I'll come back in. How about now?
Yes.
He's in a t-shirt
Yes.
and a woman in an orange shirt?
Correct.
Here we go.
Today is the day on my way to get the vaccine for the COVID-19. It's been a lot of prayer and a lot of study and a lot of conversations that led me to this moment. I don't take it lightly. You see, I'm from Tuskegee, Alabama. In fact, I was the mayor of Tuskegee, Alabama. It was the Tuskegee Syphilis study where they denied treatment of those men that eroded a lot of trust that the African American community has for the public health service. The context of the Tuskegee Syphilis study is very different from COVID-19, where in COVID-19 we are providing the vaccination, which is treatment or at least to create an immunity system for the people who are vaccinated. But the key is that it is trust. And so after working with the University of Maryland School of Public Health and listening to people like Dr. Michael Osterholm and Dr. Stephen Thomas.
Tell me when it's over.
It's over.
It's over.
I was there.
You did it already?
I did it already.
I'm taking the vaccine. I don't begrudge anybody for your hesitation or your anxiety about not taking it. I'm going to tell you what I'm doing, and I'm going to tell you why I'm doing it. But I also think that you need to get your own information and make sure that you do your own research and your own due diligence. However, I want you to make sure that you are intentional about getting it and getting information from the people who have the information. Oftentimes we listen to our friends and family members and others who don't really know what they are talking about directly, but they're not getting it from people who are working in the industry. And so if you get information, make sure that you go to the CDC website and watch town hall meetings like what we do with the University of Maryland, and listen to the people and try them by their spirit, by their heart. And if your spirit says that you can believe them, then trust the spirit.
It was not a bad experience at all. In fact, I think it was a good experience, and we look forward to coming back a month from now, which is March the first, and we'll take the second shot for COVID-19. It was a wonderful day. Thank you for experiencing it with me.
So uh, Mayor Omar is a radio talk show host, and his show is called You Got the Power. So, Professor Hoda, I took you to Macon County, Alabama, to the former mayor. Tell me what you thought about that scene.
Oh, it was amazing. I mean, it was, of course, a little distressing to think about what happened there, but also very positive to see this wonderful, articulate former mayor so uh, so wonderfully explain how we, each of us, has to really study and learn for ourselves so that we know the facts from fiction and that we know the reality of the kind of healthcare that we need to be getting at this point. No, it was a wonderful clip.
So think about it. If we did our little survey again, we may have moved some people. We may have moved some people. And that's why we have to take time. Now, I'm so glad that Dr. Sandra Quinn said, Dr. T, you need to make sure you show them this information about warp speed so they can get over their concern about vaccine safety. Remember, that was a big number there, concern about the safety. And so thanks to Dr. Quinn, your audience needs to know the vaccine development timeline. It was accelerated, but it did not skip any of the steps in the FDA approval process. Researchers used existing clinical networks. The manufacturing started early. The mRNA vaccines are faster than traditional vaccines to produce. The FDA and the CDC prioritized the review and authorization recommendations of the CDC of the COVID-19 vaccines, and the size of the trial samples and incidence of disease were really large. The Mrna trial had like 30,000 people. And so here's where the warp speed came. They gave these companies billions of dollars before they produced anything, and then more billions of dollars to buy their product before they even had a product. And if you're in the private sector, guess what? That's a whole lot of incentive. And so we produce these vaccines in Manhattan kind of project speed. The Pfizer trial had 43,000, call it 44,000 people, 13% Hispanic, 10% African American, 45% were between the ages of 56 and 85. That's for clinical trials, excellent. Mrna, 30,000 people, 20% Hispanic, 10% African American. There were no significant differences in safety and efficacy by racial ethnic group. Okay? What are the myths about the mRNA vaccines? Will it alter my DNA? These are the questions, Professor Hoda, I get from the Black Barbershop. Will it change my DNA, Dr. T? It does not affect your DNA. mRNA does not enter the cell's nucleus. But you see the kind of time we have to spend with people to explain this to them. Will it give me COVID? If I get the COVID vaccine, will it give me COVID? Will I test positive on a COVID test? It doesn't contain live virus. It cannot give you COVID-19. Here's another question. It's a brand new experimental. It's never been tried. Well, mRNA vaccines actually have been studied in diseases like influenza, Zika, rabies, and cytomegalovirus. The issue is that all this science has never been in the front pages of the newspaper every day. And so everyone's getting a crash course in vaccine development, crash course in public health, crash course in pandemic mitigation behaviors. So we have an opportunity to strengthen vaccine acceptance by having better knowledge about COVID-19, the vaccine process and recommendations, taking this to the community, bringing the community into town halls, the perceived risk of the vaccine, side effects, and the risk of disease. Trust me, Dr. Hoda, that little pain I had in my arm after the shot was a lot less than me in a hospital on a ventilator. That's the kind of comparison we have to give people. And then the individual and collective benefits of the vaccine. If we all do this together, we will save the planet. We will reach herd immunity. And I have to say something, when I use that word in the Black barbershops, they say, Dr. T, I'm not a cow, I'm not a horse. Why are they saying herd immunity? Back in the day when we were slaves, they treated us like animals. They said, Dr. T, if the whole point is to make sure the community is safe, why don't they just say community immunity? I like that, Dr. Hoda. If community immunity doesn't take away the science, well, then let's adjust our language to be more appropriate and more acceptable to people who have historically been hesitant. Community immunity should be our bumper sticker. And so the role of healthcare professionals is very important. These are our front line. They've seen a lot of stress. They've seen a lot of death and suffering. They truly are the heroes. They need to demonstrate empathy, acknowledge that it's okay to have questions and concerns, acknowledge what we know and what we don't know, be ready to answer questions about efficacy, safety, and particularly for specific populations, and be role models and take the vaccine. So here's, Dr. Hoda, what you need to know. Right now, as we speak, there are some healthcare workers on the front line who have witnessed the suffering, who've held the hands of people who have died, who are hesitant to take the vaccine. And you have to say, what do they know that we don't know? If there's anybody that knows what this disease can do, why are they hesitant? Maybe in the discussion we can talk about that. And so as I head to the finish line, we need to make strong recommendations for people to get the vaccine when it's their turn. Now, I think we also have an ethical responsibility. After the aftermath of the Tuskegee study, there were federal regulations. And those regulations resulted in the ethical guidelines we live by today, the Belmont Report. So respect for persons means that's when you're going through that informed consent, they have to respect my autonomy. Beneficence, do no harm. Don't put me in a study or give me something that has more risk than benefit. And justice. The principle of justice means that those who bear the burden of research or bear the burden of disease should not be denied the benefit of the science. And so it's very troubling. Just a few days ago, front page story in the Washington Post, how Talbot County in the Eastern Shore had more people vaccinated than in Prince George's County, which is the hot spot for the state. And people were really upset seeing that. They were upset seeing wealthy white folks come into Prince George's County and get in the front of the line. Those things are just simply evidence of the broken system we're living in right now, but they can exacerbate racial tension. So the principle of justice, those who bear the burden should not be denied the benefit. And history would show that Black people, brown people, vulnerable populations have historically been the research subjects around which science is developed. And those same people, be they in the United States or in the developing world, do not get the benefit. So if they tested Moderna and Pfizer vaccines in parts of Africa and South America where people are poor, and now we have a vaccine, and those very people cannot get the benefit, that is a violation of justice. Now, Professor Hoda, how are we doing on time?
We're almost there.
Well, I'll just take you into a little piece of what our innovation looks like to turn the whole process on its head, to get to the people where they live, work, play, and worship, and guess what? Where they get their haircuts. The thing about Black barbershops and salons is that no Black barber would ever say, I'll get you in and out in 15 minutes. It is, you're going to be there half a day. You're going to be getting caught up on the news. You're going to be in a community gathering. It's a sacred space. And so what we have done is to bring the doctors and the physicians and the health professionals into this sacred space to have conversation with the community. And it's been an amazing program. We call it HAIR, Health Advocates in Reach and Research. And the training that we've put our stylists and barbers through has now been accepted by the state of Maryland, and our barbers and stylists have become certified community health workers. And so when you see this setting and this scene, it's just an amazing space. Again, a space that's pretty segregated when people go get their hair done. And this is why we're introducing it to a broader audience. We brought in the artists and the sketch artists so they can take this information and take it from the tables and charts and bar graphs and put it into a form that people will find more acceptable. And we put in mailboxes in the barbershops where you could drop in your question about health, and my team and students create infographics to help people understand their concerns. And then we brought in COVID saliva tests into the barbershop so that these barbers and stylists know their status. These are the things that we can do to rebuild trust, to make sure that, in this case, the barbershop and salon is a COVID mitigation site where you can get a mask, learn how to protect your family, and get a good haircut. And so with that, I won't go into, maybe in our discussion, we'll talk about our use of virtual reality as a way of, again, scaling up these conversations. And I'll just leave with this to say that for those in the audience who don't think racism is an issue and it's not scientific, there's a danger to assume that racism is not relevant in the scientific pursuit of solutions to eliminate health disparities. There is a danger that some populations will always suffer premature illness and death by virtue of their culture-bound lifestyles. We can't say, oh, those people live that way, therefore just let them suffer. It's not our job to get into their business. It is a danger to assume that the elimination of disparities is impossible because health equity is unachievable in a free market society. That is a real good discussion for us because capitalism is going to be here even on the other side of this pandemic. We have an opportunity to recognize health disparities as an issue of justice because specific groups were subjected to systematic racial discrimination and denied the basic benefits of society, a violation of our social contract. And so you see, I've changed my background to something that has no words, but you know exactly what it means. A church window with the AIDS ribbon, someone's suffering from the disease or having a family member with the disease. If they were to see this, they would know that place was a sanctuary for them. The artists haven't caught up yet in the COVID pandemic. We need to bring the humanities in to come up with the iconography and the images that will help rebuild trust in our communities. And with that, Professor Hoda, it has been so much fun hanging out with you today.
It has been a lot of fun and also lots of very, very important information for all of us. I really appreciate the way you approach this topic with such sensitivity, with such attention to the ethical component and the humanness with which you approached a very sensitive topic. I really appreciate that, Professor Thomas. Thank you so much. And with your permission, can we now go to some questions and answers?
Absolutely.
So the audience, you know that there is a Q&A function at the bottom of your screen, and we encourage you to type in your answers. We hope we'll get to all of them, but we'll see. All right, so here we go. Isn't the reality, this is from Cynthia Mariel, isn't the reality political health versus public health?
You know, I think that to recognize that politics is in our science and in our healthcare systems. And while we may have liked to think that we were distant from that, the past 4 years taught us otherwise, didn't it? The past 4 years taught us how politics and the politicalization of health promotion, disease prevention, the politicalization of wearing a mask, the politicalization of the COVID mitigation behaviors can actually cause people to suffer. 4 weeks of a new administration cannot change that overnight. So yes, we have issues around politics. And the question is this: can we pull in the same direction? There were groups in California at the big Dodger Stadium vaccination site that were there to disrupt the vaccinations. They were protesting against the vaccinations. There have been directors of health departments that have quit their jobs because they were getting death threats. It wasn't long ago that Dr. Fauci had to get more security. We cannot have short memories on this, people. So now we see how brute politicalization in the public health space can result in more confusion, more disunity. And when they did the analysis of where was the disinformation coming from, and disinformation means, Professor Hoda, I am actively trying to confuse you. The main source was from the biggest microphone in the world, the White House. We've never seen that before. We hope we never see it again. And now we have to rebuild trust in our institutions. So I totally agree on the politics. And now we need to talk about civic engagement. Civic engagement. Very important that we vote, that we fill out the census. I hope that now everyone's attention has been focused on politics matters.
Thank you. From Jerome Dansis, I hope, let me read this. Is there vaccine efficacy for Black people age 65 and above? And I'll stop there and see what.
So the answer is yes. And one of the things that they did in the trials, in all the trials, is they have to have sufficient numbers in this age cohort. So if you saw when I went through the Pfizer and Moderna, they had numbers specifically of people in that age group. And so the evidence to date is that it is efficacious for those ages. And the concern now is not going up, but the concern now is, can we go down? Can we go down to elementary school kids or smaller children? I think right now they're doing the trials on children. They have a way of doing that where they don't need 30,000 children. They have a way of doing that more quickly. And that is an effort because children can be infected but no symptoms, Professor Hoda. So now you have children, they seem fine, but they're literally spreading the virus to vulnerable groups. So the aim was to get those vulnerable groups vaccinated first. Those in nursing homes, those with pre-existing conditions, those essential workers. And that is fraught with challenges as well. Who's an essential worker? I bet that the sanitation worker, your trash has been picked up during this entire time, hasn't it? You've gotten mail during this entire time. Your packages are coming. Many of those people probably didn't think of themselves as essential workers based on their pay, but there they were. And they were required to be out, exposed.
From Vivian Lau, what would you say to persuade people who are reluctant to take the vaccine because we don't know the long-term effects of the vaccines yet?
I would say that the companies are required to do long-term follow-up studies with the people, with the cohorts in their clinical trials. In fact, in the way they did it, even this time before they could even get approved, they had to have a certain number of days post the last vaccine to determine what the effects were. Now that window was not years, that window was more like 30 days, but they're following these people over many months and years. And we also know the situation of what's being called the long haulers, the people who have been infected, but now even after they have cleared the virus are suffering from the consequences. There's a front page today, a 30-year-old who is now disabled because she is still suffering side effects of COVID-19. So you do not want to get this virus. Even if it keeps you out of the hospital, the vaccines are effective for preventing the negative consequences of severe illness. So just because you don't get to the hospital and end up on a ventilator doesn't mean that you will not have serious consequences of being infected with COVID. You do not want to get this infection.
Thank you. From Michael Penn, Professor Thomas, can we anticipate a shift in trust with a change in the presidency? Is not trust also linked with those who wield power?
So I think that the hope we saw in that word cloud, I've attributed in large part to the new administration. We've done word clouds during our previous town halls, previous administration, and we did not see hope at all. So I think hope came right after the election, but you see how fragile it was with all the anxiety around it. So I think that people are going to give the benefit of the doubt. They believe that science is back in charge. Dr. Fauci seems like he's completely liberated and free to speak the truth. And I think that it's important that we use forums like this to bring people together, those who control the system and those who have lost all hope in the system. And guess what? I would never have imagined that Zoom would be a way to do that. And I think we need to create forums where we have that kind of mix in the same audience and have a conversation.
Thank you. From Melinda Cecil, as a professor of community nutrition at a sister university, UMES, I discuss strategies to build trust. I would like to hear your take on this vital issue. Also, UMES has yet to receive the vaccine we are supposed to be able to administer.
The University of Maryland Eastern Shore, our historically Black college, our land grant institution. That's a shame that she has to say that, isn't it? And it helps, and it erodes trust. Trust is a calculated risk. How can I trust you when I know what you've done to me in the past? It may not be you personally, Professor Holder, but people who hold your position, people from your institution. That means there has to be a period of time where you have to reprove yourself that you're not going to hurt me again. And this is why what's happening now is so tragic, that Dr. Moore's situation in the hospital erodes that trust. Even before COVID, it's what people had experienced in the everyday discrimination trying to access healthcare. It's people waiting sometimes too long before they seek care. And some of the science that we have simply can't help them because they waited so long. Well, the last thing you want is for that health professional to say, well, you waited so long, now we can't treat your cancer. So people feel that they're being shamed. They're being blamed. And in the early days of the pandemic, they would say those things like the pre-existing conditions, the diabetes, the heart disease, the prevalent conditions in the Black community. They would literally blame them for that, like it's their fault that they're obese. So that's what we have to guard against. I think this is an opportunity to build those bridges of trust back, but the distrust has been earned. And now we have to prove ourselves worthy, being trustworthy. And so when we're in the community, when we hear things that we need to bring back to our institution, we need to make sure that we lift up the voices of the community and echo to our institutions and the powers that be in our institutions of how to make life better. So now they're going to bring the vaccines to the pharmacies. Well, guess what? Where do you think the pharmacies are located? You think they're located in the food deserts? Where you have food deserts, you have pharmacy deserts. These are the issues that are beyond the control of an individual. But Dr. Holder, they're looking to you, a professor. They're looking to me, a professor, to come back to the University of Maryland and go right up to Dr. Pines and tell Dr. Pines, how do we help this community get better access to grocery stores, get better access to green space, get better access to the very things that can improve their quality of life. They're expecting you and I to do that. I think we need to take that challenge on.
Couldn't agree more. And Dr. Pines is the new president at the University of Maryland at College Park.
And he looks like me. He's a Black man in America. That's the key.
Yes. From Neda Long, what role do you think health plans like Blue Cross, Cigna, etc., need to play in addressing disparities in healthcare?
Well, I think the whole thing is a mess. And all you have to do is look at, again, Switzerland, Germany, United Kingdom, even Canada. We can go down the list of our peer countries, the countries we compare ourselves to, and we will find that their death rates from COVID are much better. Their illness, all the metrics we've been measuring, they've done a better job. Well, what's so different about them and us is because of the way their healthcare system is organized. They have, in Britain, I'll just use that as the example, the National Health Service. So in those countries, health is what? It's a right, Professor Hoda. It's not a privilege. It's not your ability to pay. It's a right as a member of that society. Now, whenever we start talking that way here, you know what word comes up? It's kryptonite. It's a kryptonite word. It starts with an S. Do you know what I'm talking about? Socialism. That's like kryptonite.
Yeah.
And so here we are still in a basically fee-for-service model that's broken. And now we've watched how the Affordable Care Act was gutted and crippled and weakened, which was an effort to bring more equity and care to the people. But this new administration has, and even here in the state of Maryland, they've opened up the exchanges. So I think that the insurance companies, the payers, can be part of the solution, but they need to hear from us. Many people who won't even pick up their phone for fear of it's a bill collector because I was at the hospital, I was in the emergency room. And when hospitals do that kind of aggressive bill collecting, it changes the relationship people have with their local hospital. So I think COVID has exposed a number of things. Now notice right now that the COVID vaccines are what? Yes, free to the consumer. And the states will try to recoup money from the insurance companies. But think about all the other life-saving technologies before COVID. Why aren't they also made available? It's a question we need to grapple with moving forward.
Thank you. The next one is from Anthony Vance. My understanding is that the overall mortality rate in the United States among those who have contracted COVID-19 is roughly 4%. However, among Blacks, Latinos, and indigenous communities, the rates are in the range of 6% or higher. I'm very interested in the impact of low income or poverty on mortality. One way to assess that would be to ask, are these figures for mortality among Blacks, Latinos, and indigenous populations broken down by income levels? Or alternatively, are there figures that show that wealthier upper third in income levels of Blacks and those other populations suffer mortality rates at or below the 4% national average?
So we have an epidemiologist, economist out there. That may be a show all in of itself. But let me submit this simply to say that Dr. Moore was a physician, therefore in the upper income bracket. It didn't save her. COVID doesn't care, so somehow she got exposed. But more importantly, for the question, it didn't save her from being discriminated against because of her race. And there again, we're back to the color line. I think we have to grapple with the issue of race here in Prince George's County, which is the wealthiest majority Black municipality in the United States, okay? And yet we're the COVID hotspot for the state of Maryland. So I think it's an interesting question, and it's a question in many ways that we can answer here in Maryland and in Prince George's County because of the diversity of our populations. But we have found that the hesitancy and the distrust in the African American community crosses these income brackets. So I think it's an interesting and important question. The other issue, Professor Hoda, is that we're one of the few states that's even releasing our data by race and ethnicity. It is not happening across the country. So some of this information actually may be an underestimate of what's going on nationally.
I have a feeling it'll be a long time after this is all over before we get the true picture and the numbers. I'm going to ask a question that that the individual, if you've asked one question, I may have to skip so that others have a chance. This is from Nicolette Paul. Despite the fact that many people are reluctant to take the COVID vaccine, it seems that for those who want it, the availability is low. For example, my dad has been trying to get the COVID, let's see, it just skipped on me. My dad, anyway, and he's been unsuccessful. And this is in PG County that he's been trying to get this. So,
well, I think that therein lies a real dilemma and something that we should be in some ways ashamed of. Because now here's what we've said: to get this life-saving vaccine, register. Oh, how do I register? Oh, go online. As if everybody just goes online, as if everybody just lives on their computers like you and I do all day. My 85-year-old neighbor across the street still has not gotten a call back. But I've gotten my vaccine when 1B, that included teachers and higher education, but it required, and I'm going to just tell the truth here for all the men in the audience, my wife sat there, refresh, hours. And finally, it popped up. My 85-year-old neighbor is not going to do that. She's got a flip phone. So I think it's really, that's the example of the inequality. So on the surface, you say, well, it's equal for everybody. Just log on and register. But if you don't have access to the internet, if you don't have the time in the middle of the day to keep refreshing, well, then it is inequitable. And I think that equity has to be the lens through which we look at how we roll these things out. And why are sophisticated computer types like us figuring out how to jump in line in poor communities? So we have a front page story that describes wealthy whites showing up in inner city minority communities getting in the front of the line. And again, it just exacerbates the problem that we're faced here. So if the internet is going to be our way to obtain life-saving services, guess what? The internet should be like your water in your house. The internet should be like you turned on the electricity. It shouldn't be a privilege if we're going to put life-saving services on the other end of that line. So what are we going to do here in the state of Maryland to ensure that we have internet access all the way out across with our friends in the Eastern Shore? And how do we make sure our friends at UMES get the vaccine allocation they were promised? I think we have to advocate for them.
thank you so much. From Fevan Hurui, do you believe that minorities like African Americans' distrust of the healthcare system will eventually completely disappear despite history, such as the Tuskegee experiment? If so, what role does embracing such history play in either instilling more distrust or showing the public that institutions use it as a reminder of what not to do and how to improve?
Well, we've been in this space before, even before COVID, and even back during the days of HIV, where my health colleagues would say, that was so long ago, don't even bring it up. But it's only been in my lifetime, in the arc of my career, Professor Hoda, that right now in many schools of public health and schools of medicine, that they're at least being taught. They're at least being taught about it. But there is a reckoning going on across many domains in our country, not just with the removal of the Confederate flags on state flags, the removal of Confederate statues, but there's been a removal of medical scientists who did unethical research, but were lifted up and venerated. So the father of gynecology, there was his statue, I believe, was in Philadelphia, was recently taken down because the procedures that he perfected, that are in many in use today, were perfected on poor Black women, some slaves, without the benefit of anesthesia. It's a tragic history. I told you I was at the University of Pittsburgh for 10 years. The building we were in was called Perrin Hall, named after Thomas Perrin, the Surgeon General of the United States during the Tuskegee study. And the students over time, as they learned that history, said, I don't want my degree coming from a building where the Surgeon General who oversaw the Tuskegee study. And 2 years ago, the name of that building was changed. So there's a reckoning that we're dealing with across many domains, including health. So I think there is an opportunity to rebuild trust. I think having diversity in the healthcare workforce helps, but also helping the majority of that workforce, the majority of that workforce is white, having that workforce retrained, retooled. And in my little effort, I retool them in the barbershops and the beauty salons. When they come into those spaces, Professor Hoda, you know what they say? This is why I became a physician. This is why I became a nurse. They love being out of that setting in the hospital and clinic and right there where the people are in settings they trust, be it the church, be it the barbershop. I think we need to do more of that.
Thank you. We're almost out of time. I'll ask this one and then we'll see if we have time for one more. This is from Maya Blake. Is there any information on maternal health and COVID in communities of color?
Very, very good question. They answer it this way, that over the course of those clinical trials, guess what? There were women that became pregnant. They did not recruit pregnant women. It just so happened that people in the trials became pregnant, and they have some evidence of impact on the women and their children. I think we need more data. And for that audience, I think for some of these clinical questions that have come up, you and I will come up with some resources that we can send back. But right now, and if anyone's seen Dr. Luina Nguyen, former commissioner for the city of Baltimore, she speaks specifically on this maternal pregnant women and the vaccine and COVID. And I don't want to speak for her, but my point is that there's good news that you should get the vaccine. And most importantly, talk with your OBGYN physician about any other conditions that you might have that might be a counterindication. But on its surface, it is not a counterindication at this time.
I think we are out of time, and so I'll stop the questions, although there were many questions. You gave such an interesting presentation that people would like to keep going, but I would like to really take this opportunity to, again, thank you for a most interesting presentation, for educating us not only about COVID-19 and its colors and inequalities, but also about what is happening in Prince George's County, which I think as a university that is situated in that county, certainly we have a responsibility to see in what ways we can expand ways to cooperate and collaborate with the county. It's been an honor having you, Professor Thomas. Thank you again.
It's my honor and pleasure. Thank the audience, and I'll work with you on those questions and we'll curate them and come up with a way of providing answers to your audience.
Yes, thank you so much. Meanwhile, I want to remind our audience that our next event that will be coming up on March 2nd is What Thwarts and Enables Feminist Activism Around the World, a very interesting topic, which will be given by Dr. Alice Evans from the King's College in London. So we hope you join us for that. And if not, we have other events coming up. And I'll just tell you that I really encourage you to go to our website because all of our events and news are listed there. But more importantly, if you follow us on social media, on our social media, you will get all this information in time. Thank you, audience, for joining us. It's been a wonderful session, and we hope to see you next time. Bye-bye.
Bye-bye. Wear your mask, wash your hands, stay away from crowds.